A couple of weeks ago, right before Mother's Day, we had a chance to come out to Associates in Plastic Surgery and spend some time talking with Kayla about the M-Sculpt machines they have here and the different ways they can help moms out there look and feel their best. Well, we're back this morning talking with Dr. Chris Chase about his work in their in-house surgery center here at Associates in Plastic Surgery, and to say a big congratulations, 10 years of giving back to women in the Chattanooga area who want to look and feel their best every day.
Yeah, thank you. Thank you for being with me today. And I want to thank Chattanooga for their support of our practice and the surgery suite, which we're really proud to have a 10-year anniversary now.
I have to tell you, when we were coming here this morning, I didn't know quite, well, the first time, I didn't quite know what to expect, and I had been told, you'll see it, because it's this big historic home in the Germantown area, not far from Glendon Place in Brainerd, but I didn't quite know what to expect. It is so inviting and welcoming when you first come in. For women, that makes a big difference because you can relax the minute you walk in the door.
Right, right. I think our patients really appreciate the environment. And I always loved this home, and I would see it as I drove by, ended up purchasing it and converting it into our office space with our in-house surgery suite. So
I think it's a relevant point to bring up, because for a lot of women, this might be their first time to come to you for cosmetic surgery, and they would be a bit nervous. So anything you can do to put them at ease is important. But then they find out that for these 10 years, you focused really kind of specifically on just the cosmetic side of it to give women the look that they're wanting.
Right, right. That's the best part of my job, is seeing a happy patient afterwards that has achieved the result that she wanted to achieve, and just the appreciation that they have and that I feel, and you know, yeah. It's just very rewarding.
So something that you wanted to do when you would drive by and eye this house was that there was the space here, and I mentioned it earlier, for you to have an in-office surgery center. That's somewhat unique in your ability to offer that to your patients.
Yeah, it really is. You know, having an in-office surgery suite is just much more convenient for the patient. It saves them money, and you know, it's just very comfortable and everything. And we have a very experienced staff, and we have excellent anesthesia providers, and it's really perfect.
Okay, you mentioned the money part of it, so I'm going to go there a little bit, because this is an investment that women are giving back to themselves. And now probably a lot of us think a long time before we finally pull that trigger, and we talk to an awful lot of friends about what have you done or who have you heard about. You really, from what you've told me, try to look at each woman for her unique self when she comes in. You don't have a preconceived idea. You want to hear what her wishes are, and then try to make that happen. Exactly,
yes. So we see them in consultation, and we discuss their desires, and we evaluate them, and then offer solutions and achieve those goals.
But you must have to offer your expertise too. I'm sure they want that, because they may have one idea in mind, but in your years of practice, you may guide them into something to perhaps reconsider. That's part of the conversation, right?
Absolutely. Yeah, a lot of times people have done a lot of research, and they come in kind of knowing what they want, and a lot of times they just come in cold. But either way, we guide them along, you know, offer them the best options, but we pretty much let them choose. But oftentimes they don't really know until we tell them, you know, what we advise.
So you are the only surgeon here, right, in the practice? It's
Correct.
Just you.
Right.
So your calendar is somewhat booked out. But let's say that someone's watching and she wants to come in and make an appointment with you. What does she expect on that first visit?
Right. The first thing is, you know, call and make an appointment, and sort of plan ahead, because we are booked out, and so it's wise to get in as soon as possible.
Sure.
And then at that point, you know, we see them in consultation, we get their history, we talk about their desires and everything. We do an exam as needed, and then we offer them, you know, what we advise, and then we give them the quote sheet, which includes all the costs and everything, and then we go over a lot of information with them. And then we kind of have an open door policy as well. After that, they can call back with more questions, because a lot of people are nervous and can't
Sure.
remember everything. But then after that's all wrapped up, then we let them talk with our scheduler and she goes through, how that process works.
So, none of us will stay 18 or 22 or 27 forever, right? Gravity kicks in at some point for everybody. So you do see a lot of women who are on their second or third child and their body's just shifted and they want to kind of feel like themselves again.
Right, yes, that's a very common patient that we see who's gone through pregnancies and had changes in their breasts and abdomen that they're not real happy with. And so that's very common, a so-called kind of mommy makeover, which includes the breast and abdomen. So typical procedures would be breast augmentation or augmentation with the lift or lifts alone with a tummy tuck, which is also called abdominoplasty.
Do you try here at Associates in Plastic Surgery to specialize in just a few areas and not cover everything?
Right, I cover a lot, but not everything.
Yeah, because that helps you kind of perfect what you do.
Right. So
Go ahead.
I was just going to say we do a lot of facial work, breasts and bodies are our most common sort of categories. And after weight loss, we do a lot of arms, just removing the excess skin in various areas. Yeah.
The dreaded flab that we all tend to get. Before I let you run and get into your surgeries today, on the facial part of it, you have to be kind of an artist with that, don't you? Because you've got to look at the symmetry of a woman's face to know what
That's
to
very
do.
true. And I think really we have to be artists in all areas because you have to know the aesthetic norm or the aesthetic goal, the perfect, but you can't make people perfect necessarily, but you can get them as close to knowing the established guidelines of what is the most attractive appearance for a person.
Right. And to let it reflect her personality too.
Right. And I strive for a natural result personally, as far as the face goes. So I think I'm known for that, for like people not looking like they've had surgery and being called out on a plane or something like that.
Well, congratulations on 10 years, and you have every reason to celebrate that. And I'm sure you've heard his name floated around town for a lot of those years, and now you have a chance to hear from him, Dr. Chris Chase at Associates in Plastic Surgery on Navajo Drive in Chattanooga. It's a big year for them, and they would love to help you become one of the women walking around feeling like you too are back to your old self, but just looking kind of new. Thank you.
All right, thank you.